Here at Augustana Center for Speech, Language, and Hearing, I've started a transgender voice modification program, depending on the authentic gender of the client seeking services. So we offer voice feminization services, voice masculinization, or the gender non-conforming, depending on what the client's goals are for their desired gender presentation. Transgender people, they can present as their desired gender, but sometimes their voice doesn't match that desired gender identity. So a lot of our clients that we have gotten that typically actually seek out voice therapy are trans females. So they were assigned male at birth, and now they identify as female. But even with hormones, things like that, they the pitch level, anatomy, things like that are not affected. So they seek out speech pathology because what we're doing is we're trying to create a healthy voice without overuse. So change their voice, their communication in a way that's healthy, that's not causing any damage. We definitely have a perception of feminization, masculinization, depending on pitch. What our culture perceives. Higher pitch is voice. You perceive that as feminine. So pitch work is definitely a big part of it. I assess their voice to see what their baseline pitch is. What sort of vocal elements they are already they have naturally, and then I talk to them about their goals. What is their desired voice communication? How often they will be able to practice it, because carryover is a big piece. We have seen more success if someone is presenting 100% of the time. Sometimes we have people at the beginning of their transition, so they're not they're not speaking in public using their desired gender presentation, using that voice 100% of the time. So that plays a role. Is there an underlying voice disorder coming in that we have to address before we can talk about voice feminization or masculinization? So it really does vary. The whole program, sometimes it can be daunting because they've been speaking one way in one voice for their whole life, and I think they don't want to sound kind of go up into this falsetto Mickey Mouse voice and feel like comfortable using that. So it's a lot of kind of counseling and kind of seeing are they ready to use this in different settings. But we typically start sessions with some meditation, some relaxation, just to try and relax and be able to use the voice efficiently. We feel like we're moving with the times. We're demonstrating that all inclusiveness. We don't discriminate here, and we have the resources and the space to be able to provide this intervention.